Do not leave this podcast without going to the link in the show notes or description and clicking on the link to learn our centralization process. We will show you what you're missing in your sciatica recovery. And in this link, there will be a very important opportunity at the end for you to learn exactly what this plan could look like for you. Hello and welcome to episode 104 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is, should you stretch your hamstrings? The hamstrings are a tight area for thousands and millions of people with back pain, with or without back pain. But should you be stretching them? Today's discussion might pique your interest. Now, of course, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. If you type that into Facebook, you will join the group and you will immediately be tagged in our free step-by-step sciatica guide that we have used to help thousands of people around the world recover from sciatica. You will get this for free just by joining, and there's tons of other valuable content in there as well. And you will immerse yourself in a community of people who are serious about getting better. So go join my private Facebook group, RehabFix Low Back Program, for this free guide and many other guides and to interact with me. Now, this episode, should you stretch your hamstrings? Literally every single person we talk to, without fail, will state how they feel their hamstrings are tight, especially those people with back pain. Many people have been told their hamstring tightness is the reason for back pain. Is that true? Certainly not. Certainly not. Okay. Muscles don't just randomly decide to be tight. They're trained to be tight, or they're guarding for a particular reason. Most of the time, hamstrings are tight as a result of poor low back function, not as a cause of low back function. The old saying will be, if your hamstrings are tight, then it's going to pull your pelvis down and that puts more pressure on your back. No, not true. Tight hamstrings do not cause back pain. There's no evidence to support that. Some people might say, the kinetic chain, it's going to pull through and affect these other areas. Nah, tight hamstrings are a symptom. Tight hamstrings are a symptom. Almost always a symptom. I'm not going to say almost. I'm going to say always a symptom. All right. They're a symptom of low back issues. You resolve the low back, hamstrings will return to normal tone. You see our clients all the time who can barely bend forward because of back pain or because of sciatica in the leg. They'll feel a lot of tension in one leg more than the other. We're not stretching their hamstrings to get them to improve their flexibility. We're addressing their low back. We're addressing the nerve. We're addressing the disc, and then they can bend further forward. It has nothing to do with the hamstrings. So remember, your hamstrings are a symptom. Now, the two reasons why you should not stretch your hamstrings. One, it's just typically a waste of time because it's a symptom, right? If your low back is the problem, but it's sending pain to other areas of your body, you shouldn't waste your time addressing those other areas of the body because that's where the symptom is. Address the cause, the low back. Well, your hamstring tightness is typically a symptom, especially if you have sciatica. If you have sciatica down one leg, or nerve symptoms in that one leg, that hamstring's going to feel tighter for sure. If you spend all day stretching that, it's going to be a complete waste of your time because you're not focusing on the area of the problem. The second reason you should not stretch your hamstrings is because many times you are actually putting additional tension on that nerve or that disc. The act of sitting and leaning forward and stretching towards that hamstring is tensioning the nerve. So many people with sciatica, or who have been told they have piriformis syndrome or any variation of nerve-related pain or disorder, will typically say when they try to stretch that leg, it increases, it gets worse, it gets more sensitive. It's because you're stretching a sensitive nerve that is irritated. Imagine if I just strained a muscle, and I'm trying to lengthen and stretch that muscle every day while it's strained. It's not going to like it. It's not going to feel good. So when you have sciatica, a nerve that's irritated, a disc that's irritated, and you're bending forward, putting more pressure on the disc, stretching a nerve that doesn't want to be stretched, you're just irritating it over and over and over again. We have literally helped some people fix their sciatica purely by telling them to stop stretching their hamstrings. No joke. That's all they needed to do. Stop stretching it and they got better. But they were told from 10 other PTs, chiros, physios, whatever, that, they need to stretch their hamstrings. The advice they were given was literally the very thing that was keeping them in pain. So if it's tensioning that nerve, if it's feeling worse on that nerve while you do it, It's probably not the right thing to do. Okay, it is not needed. The hamstrings are not a cause for back pain. They're a symptom of back pain. It's typically a waste of time to do so. And if you have sciatica, stretching that will make it worse. Okay, so what are some things you can do to improve the tone or the flexibility of your hamstrings? Well, one thing, load them instead of stretching them. What do I mean by load them? I mean strengthen them. Okay? There are many ways to strengthen your hamstrings. Sure, you could do some typical seated hamstring curls or lying leg curls at the gym, but let's say you don't have a gym membership and you want to do it in a more optimal way or a functional type way. One thing we like to do a lot is hamstring sliders. Imagine I am laying on a hardwood floor or a tile floor and I have socks on. I get into a glute bridge position. I push my hips up off the ground as far as I can, okay? And then while keeping my hips high, I slowly slide my heels forward. Slowly, slowly, slowly. Maybe it takes 5 full seconds to do that. My hamstrings are getting a big eccentric contraction on that. Eccentric contractions can really help to lengthen muscles and reduce tone. So that's a way you can strengthen your hamstrings and improve the tone of them, by strengthening them in that particular fashion. There are other ways that we can eccentrically load hamstrings, but that is one simple way. Of course, many different strengthening-based movements will help as well. But load the hamstrings. Don't stretch them. Load them. Now, there are other influences for what could cause hamstring tension. Let's assume you don't have disc issues. Let's assume you don't have sciatica issues. Improving your core function can improve hamstring flexibility. So belly breathing, diaphragmatic breathing, improving your core function through like dead bug variations, bear holds, crawling, things to improve the way you breathe and the way you brace. That can improve hamstring flexibility immediately. Regaining low back awareness. So we call this, segmental control type movements. Learning how to control the low back, nice, slow, controlled mobility to regain that mental awareness, that neurological control. That can improve hamstring flexibility. So examples would be a nice, slow, controlled cat-cow, an FRC type movement, functional range conditioning for the low back could be useful for this. Things of that nature. Okay. Pelvic tilts, things to just gain control down there. Now, if you are someone who does have disc-related issues or symptoms or sciatica, then the number one thing to improve your hamstring tension is going to be addressing the disc or the nerve. Address the low back, resolve the disc issue, resolve the nerve issue, voila, the symptom of the hamstring tightness will go away. That's what we see with our clients all the time. They have the sciatica, the leg always feels tight, the glute feels tight, the hamstring feels tight, the calf maybe feels tight too. No stretches or anything are helping it. Yeah, because you're tensioning that nerve. It's probably just making it worse. We properly assess them. We take you through a movement assessment. We figure out what's going to get you results live during our initial call, which is why if you're listening to this, you need to do this. You need to sign up for one. Get out of pain. Do something about it. Come on now. Let us help. And then after we identify what's going to help your back, we continue to do that. Progress. Resolve the disc, resolve the nerve, voila, hamstrings are better. Hamstrings are looser, no more tension in that leg. It can be that simple. You just need a plan to do that though. So I hope today's podcast helped shine some light on my opinion, but most good professionals' opinions on the hamstrings and how they're not really all that cracked up to be the devil that so many people make them out to be. Okay? I have not stretched my hamstrings for probably 8 years. I can touch the floor on a moment's notice. It's because I have good core function, I have good low back function, and I load my hamstrings. So take it for what it is. But if you are dealing with disc herniation or sciatica issues and you are someone who's noticing that stretching your hamstring is making it worse over and over, stop doing that. Get an appropriate plan, contact us so we can help you do that the right way, resolve your back pain, your disc issue, your sciatica the right way, because this is literally our job. This is what we do with thousands of people around the world, and you can be a success story too. How can you be a success story? Visit the link in the bio or the show notes of this post. Click the link, schedule a call with us so we can take you through our process. We can show you how our process works, and we can give you the appropriate plan that you need. Stop guessing on your own. Let a professional help you. We will literally do all the work for you. We will give you the plan. We will design the plan. All you got to do is just commit. As long as you do that, you can be pain-free too, just like hundreds of our other clients who have avoided drugs, injections, and surgery. And I want to see you be a success story. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.